Hey there. I think you're interested to know us for clicking on this video, aren't you? By the way, I am a carbonic anhydrase inhibitor. I have two drugs under my classification, the cetazolamide and methazolamide. I belong to the diuretic class. Yep, I am a drug that makes you pee. But what exactly am I? What am I used for? And how do I do the things that I am an expert at doing? As carbonic anhydrase inhibitor, from the word itself, I inhibit the activities of carbonic anhydrase. But what are carbonic anhydrase? Carbonic anhydrase are enzymes present in red blood cells, ciliary body, gastric mucosa, pancreatic cells, and in the main site of my action, which is in renal tubules. They catalyze the formation of carbonic acid from carbon dioxide and water, which can freely dissociate into hydrogen ions, which is acidic, and bicarbonate ions, which is basic. Hence, they play a role in acid-base balance, leading to the maintenance of ideal blood pH level. Meanwhile, inhibition of carbonic anhydrase in the proximal convoluted tubules and nephrons leads to diuresis, and here's how. In the epithelial cells of the proximal convoluted tubule, carbonic anhydrase perform its activities. Let's start with the normal processes of the carbonic anhydrase. Here, we have carbon dioxide and water. It is catalyzed and formed by carbonic anhydrase into a carbonic acid. This carbonic acid can freely dissociate into a hydrogen ion and bicarbonate. Let's trace the hydrogen ion first. Hydrogen ion is carried by a transporter acting as a sodium-hydrogen pump. When hydrogen moves out of the cell, sodium moves in. Sodium is reabsorbed back to the blood in exchange of potassium using ATP. Meanwhile, this bicarbonate ion is also reabsorbed back to the blood. However, this reabsorption of bicarbonate is not 100%, meaning there are some bicarbonate that are not reabsorbed into the blood. Some moves out into the lumen. Now, the hydrogen ion that is already in the lumen binds to bicarbonate ions there, forming into carbonic acid, which dissociates into water and carbon dioxide, and the entire cycle begins. Now, as a carbonic anhydrase inhibitor, what I do is that I inhibit this entire process. I am inhibiting the carbonic anhydrase from forming carbonic acid. Hence, no hydrogen ions and no bicarbonate ions will be produced. When there is no hydrogen ion present, this transporter does not work. Hence, sodium is not reabsorbed and remains in the lumen together with other bicarbonate ions there. Remember that where sodium goes, water follows, so there will be excretion of sodium, water, and some bicarbonate ions in the urine. Thus, I promote diuresis. Aside from promoting diuresis, I am also suitable for the treatment of glaucoma. Yep, I inhibit the actions of carbonic anhydrase present in the eyes, particularly in the ciliary body, which results in a decreased secretion of aqueous humor. That contributes to decreased intraocular pressure, and this will be discussed later on. Among the two sample drugs I mentioned earlier, methazolamide is more potent for the treatment of glaucoma. Now, for you to learn more about how glaucoma is treated, let me be your methazolamide drug and let me introduce myself to you. My generic name is methazolamide, and I have three brand names: Gloctabs, MZM, and Naptazane. My chemical name is N3-methyl-5-sulfamol 1,3,4-thiodiazole 2-iodine acetamide. So, what are my drug classifications? In therapeutic, I am classified as diuretics, or ocular pressure lowering therapy, and pharmacologically, I am classified as carbonic anhydrase inhibitor. You might be wondering if I am safe to be administered to pregnant clients. Well, unfortunately, I'm not, because my pregnancy category is category C. I have shown teratogenic effects in rats when I was given in doses approximately 40 times the human dose. Also, there are no adequate and well-controlled studies in pregnant women. Meanwhile, you can administer me during pregnancy only if my potential benefit justifies my potential risk to the fetus.
Next is for my mechanism of action. Methazolamide is a potent inhibitor of carbonic anhydrase. Inhibition of carbonic anhydrase in the ciliary processes or ciliary body of the eye decreases aqueous humor secretion, presumably by slowing the formation of bicarbonate ions with subsequent reduction in sodium and fluid transport. Decreasing the production of aqueous humor lowers the pressure inside the eye or the intraocular pressure, which helps to prevent blindness, vision loss, and nerve damage. Moreover, I also inhibit renal carbonic anhydrase, resulting in self-limiting urinary excretion of sodium, potassium, bicarbonate, and water. Now, let's talk about my pharmacokinetics. So how does your body respond once I am administered? Before tackling about that, let's talk about how am I administered to your body. I am administered through the oral route, and my onset is within 2 to 4 hours. My peak is within 6 to 8 hours, and my duration is within 10 to 18 hours. I am absorbed in the GI tract, and I am distributed throughout the body, including the plasma, cerebrospinal fluid, aqueous humor of the eye, red blood cells, bile, and extracellular fluid. And approximately 55% is bound to plasma proteins. I am partially metabolized in the liver, and I am excreted through the urine with 20 to 25% of the total clearance of drug. And my half-life is 14 hours. Next, let's talk about my indications. METHAZOLAMIDE is indicated in the treatment of ocular conditions where lowering intraocular pressure is likely to be of therapeutic benefit, such as chronic open-angle glaucoma, secondary glaucoma, and preoperatively in acute angle closure glaucoma, where lowering the intraocular pressure is desired before surgery. Now, for my contraindications. I am contraindicated in patients with adrenal gland failure, kidney disease, liver dysfunction, or an electrolyte imbalance state such as hyperchloremic acidosis and sodium and potassium depletion states. In patients with cirrhosis, use may precipitate the development of hepatic encephalopathy.
Just like any other drugs, there are also things that you need to watch out for when you introduce me to someone's body, and these are my side and adverse effects. In the digestive system, I may cause nausea and vomiting. In nervous system, I may cause headache, anorexia, vertigo, mental confusion, depression, and paresthesia of fingers, toes, hands, and feet. In general, I may also cause body malaise and fatigue.
Now let's talk about the nursing responsibilities. Before, during, and after administering METHAZOLAMIDE to your body. Before administration, the nurse must assess for the mentioned cautions and contraindications, such as adrenal gland failure, kidney disease, and liver dysfunction, to prevent any untoward complications. Next is to assess for eye discomfort or decrease in visual acuity. Observe patient for signs of hypokalemia, such as muscle weakness, malaise, fatigue, ECG changes, and vomiting. Assess for allergy to carbonic anhydrase inhibitors, METHAZOLAMIDE, and antibacterial sulfonamides to prevent severe hypersensitivity reactions. Next are for the lab test considerations, in which the nurse must evaluate serum electrolytes, CBC, and platelet counts initially and periodically during prolonged therapy. During administration, encourage fluids to 2,000 to 3,000 ml per day unless contraindicated to prevent crystalluria and stone formation. A potassium supplement without fluoride should be administered concurrently with carbonic anhydrase inhibitors. For oral, give with food to minimize GI irritation. Tablets may be crushed and mixed with fruit-flavored syrup to minimize bitter taste for patients with difficulty swallowing.
Now, here are the things that you need to do after administering me to your patient. First, assess for the occurrence of the mentioned side effects and assist your patient to better tolerate the effects. Second, implement fall prevention strategies, especially in older adults or if patient exhibits weakness, tiredness, drowsiness, nearsightedness, or other impairments that affect gait and balance. This ensures the safety and prevention of patient from fall injuries. And lastly, assess for the desired effect. Monitor any decrease in intraocular pressure when used for glaucoma. If therapy is not effective or patient is unable to tolerate one carbonic anhydrase inhibitor, using another may be effective and more tolerable as prescribed. Now, here are the things that you need to do during patient or family teaching. Instruct the patient to take the drug as directed. Instruct not to take double doses. If medication is missed, instruct to take missed doses as soon as possible unless almost time for the next dose. Advise the patient of the need for periodic ophthalmologic exams. Instruct that loss of vision may be gradual and painless. Instruct patient that drug may occasionally cause drowsiness. Advise the patient to report side or adverse effects such as numbness or tingling of the extremities, weakness, rash, sore throat, unusual bleeding or bruising, or fever to a healthcare professional. Caution the patient to avoid driving and other activities that require alertness until response to the drug is known. Caution the patient to use sunscreen and wear protective clothing to prevent photosensitivity reactions. If hematopoietic reactions occur, such as fever, rash, or renal problems, carbonic anhydrase inhibitor therapy should be discontinued.
So that would be all for my drug autobiography. Again, I am a METHAZOLAMIDE, and I hope you learned something about me. Thank you for watching.